My name is Paramdeep Bilkhu. I'm one of the course leaders for the IP modules at Aston University. I'm also a research fellow and I have a special interest in therapeutics and ocular surface disease, but also I'm IP trained, so I do a lot of clinics in practice, particularly in an independent practice where I work at, and most of the appointments that I come across are mainly medical based rather than refractions. So it does provide variety in my day-to-day work. I think it was a challenge of doing something new, but also enhancing myself professionally, but also personally. I felt that I could offer my patients a lot more by, rather than referring or co-managing with a GP, I could do this directly. So I felt that I could offer better service to my patients, and that would not only increase their loyalty to come to see me again, but also I could mean they have better access to medications, they have access to appointments, and I could provide them with the best advice because I have the equipment available to me in order to detect and monitor disease. In terms of getting the IP, there was a series of steps that you have to take. It is challenging, it's time consuming. I mean, in the course of doing a normal practice, you have to take time out to do it. It's split over three different parts. So there's the theoretical side, you need to learn the theory behind the prescribing, pharmacology, the different disease entities that you'll come across. So relearning that was really insightful, but also I was very grateful to go through that again because it confirmed that what I was doing was correct, but also highlight areas of my practice that needed attention. So the theory was great in that respect. And then the next part was going on to the clinical placement. So I was quite confident in my own skills, but when I was exposed to patients in the hospital setting, I realised there's much more that we could do. So beyond what we refer and what goes on behind behind the scenes that we don't see once we refer was really refreshing. I mean, from a management perspective, we can see that I could see that I could do this myself. So rather than referring, I was much more confident in the fact that I would be able to manage these patients fully, and normally fully to resolution, but also on a long-term basis, I was more than capable of monitoring them. At the end, I mean, when it came to the examination process, that was tough. I mean, the exam itself, it runs twice a year, so you need to make sure that you're on ball and you timed your revision in a timely fashion for when you go ahead and do it. But once there, and you get the practice questions with the college and with the AOP, the CET that's available with there as well, enhancing your learning prepared me fully for it. And it in a bizarre way, it was an enjoyable experience, so to speak, because it confirmed everything that in the preceding 2 years leading up to the exam, it was just a way of me showing my ability rather than testing me. So that if I looked at it that way, it was more of a personal challenge rather than a box ticking exercise, so to speak. It was a good way to show that much, to demonstrate my learning, I should say. One of the initial barriers that we did have was how we would implement this into practice. Well, in terms of charging for this service or to market it. But what we found is that in the course of our normal day-to-day practice, we found that patients, they were still having these issues, they were going to see the GP. So we eventually came across, well, we provide this service here, would you prefer us to manage you here? And that was a good way of also spreading by word of mouth what we do. And so that tended to spread. And in terms of how this impacts on our practice, going forward, a lot of our staff were then receptive to the needs of our patients when they called up for an appointment. Rather than booking for a sight test, they triaged them over the phone. So they could be able to book them into appropriate slots. So the opticians or the optometrists that were more focused on doing IP saw the cases that were suitable for them. So you're making effective use of your skills and your practice, and those who just required standard eye tests could be directed elsewhere, for example. So by targeting your patients to a particular practitioner, that tended to work much better rather than doing a general clinic, which were for everybody. We found that by treating patients differently based upon their needs was much more an effective loyalty tool. And they found that not only were we there to provide spectacles as and when they needed, but also as a medical service to treat their conditions as and when they needed to. The scope of optometry is increasing massively. There's the MEC-style appointments that are being rolled out, enhanced optical services. So I would say to optometrists who are either reluctant or not sure what to do, is to embrace this change. You're making full use of your clinical repertoire when you were studying at university. You have this ideal that you want to manage your patients clinically, and then some opticians do become disillusioned and look elsewhere. So not only by enhancing yourself personally, the journey in terms of your professional development improves dramatically. In terms of managing your patients, not only will you be able to see them through to resolution, your patient will be eternally grateful to you because you see them from the start through to the finish, and that's tremendously rewarding experience. So I'll certainly suggest going ahead and doing it. Hopefully this will be integrated into the into the course from an undergraduate perspective. So when they come out, they're ready and able to prescribe. So the course by nature would increase in scope. So rather than being a 3-year programme, it may extend to a 4 or 5-year programme. So we truly do become a general practitioner, or the primary care role of the eyes. Not only do we make use of our full skills that we've been trained to do, but also we relieve the burden from a wider social perspective. We improve the access to treatment, we reduce the burden on NHS, and our patients get better access overall. So from a socialist perspective, it's a great opportunity, and one not to be missed.